फैक्टर्स की बात कर रहे थे हम. ऑक्सीडेंट ड्रग्स 3 years, एंटीबायोटिक, एंटी मलेरिया, एंटीपायरेटिक्स. Ingestion of fava beans in Mediterranean response. Severe infections, inflammatory response generate free radicals which causes oxidative damage. Signs and symptoms: neonatal jaundice, chronic hemolytic anemia. Patients do not show clinical manifestation unless and until they are exposed to the above mentioned precipitating factors. Investigation: evidence of hemolysis, laboratory investigation absent or low levels of glucose 6 phosphate dehydrogenase. Treatment: any offending drugs should be stopped. Underlying infection should be treated. Blood transfusion may be life saving. Splenectomy is usually not helpful. Cori is lactic acid cycle. It is also simply known as lactic acid cycles. It is a simple metabolic pathway in which lactate produced by anaerobic glycolysis in the muscles moves to the liver and is converted to glucose, which then returns to the muscles and is converted back to lactate. Importance: produces ATP for muscle activity through glycolysis in muscles, prevents lactic acidosis in the muscles under anaerobic conditions. Metformin, antibiotic drugs, antidiabetic drugs inhibits Cori cycle, precipitating lactic acidosis in patients with renal failure. Now, the glucose is converted to glucose 6 phosphate. Glucose 6 phosphate is converted to glucose 6 phosphogluconolactone. 6 phosphogluconolactone is converted to 6 phosphogluconate. 6 phosphogluconate is converted to ribose 5 phosphate. Ribose 5 phosphate is converted to ribulose 5 phosphate. And ribulose 5 phosphate. Two types of the ribulose 5 phosphate and ribulose 5 phosphate and ribulose 5 phosphate. There is the pseudohaptulase 7 phosphate and 3 phosphoglyceraldehyde. Pseudohaptulase 7 phosphate, erythrose 4 phosphate, and fructose and xylulose 5 phosphate. That is the other is fructose 6 phosphate. Erythrose 4 phosphate and xylulose 5 phosphate and 3 phosphoglycerate and fructose 6 phosphate. It means there are the 2 fructose 6 phosphate and 1 3 phosphoglyceraldehyde. So then we can say that glucose is converted to glucose 6 phosphate and glucose 6 phosphate converted into 6 phosphogluconolactone. 1 NADPH2 is obtained. 6 phosphogluconolactone is converted to 6 phosphogluconate. Then 6 phosphogluconate is converted to ribulose 5 phosphate and another NADPH2 is obtained. These are the processes in which 2 NADPH2 are obtained in the oxidative pathway. Then ribulose 5 phosphate is converted into pseudohaptulase 7 phosphate as well as 3 phosphoglyceraldehyde. It means ribulose 5 phosphate are the two molecules that are converted into 7 carbon compounds as well as 3 carbon compounds. Then 7 carbon compound and 3 carbon compounds means pseudohaptulase 7 phosphate and 3 phosphoglyceraldehyde. Then form the 6 carbon compounds, fructose 6 phosphate as well as fructose erythrose 4 phosphate. Now, fructose 6 phosphate is released. Now, there is the erythrose 4 phosphate plus xylulose 5 phosphate. Now, there is the nine carbon compounds. That is the erythrose 4 phosphate and other is the xylulose 5 phosphate. Now, this is the 6 carbon compounds fructose 6 phosphate and other is 3 phosphoglycerate. In this way, 3 phosphoglycerate is obtained and 2 fructose 6 phosphate molecules are obtained in this all the pathway. And we can say that in this pathway 3 molecules of glucose enters and 2 molecules of fructose 6 phosphate are released as well as 3 phosphoglycerate, and overall 3 carbon dioxide are released. And overall we can say, in other words, in this cycle 18 carbon enters and we obtained 15 carbons atoms. This is not the end product. These are the intermediates that are obtained in this pathway. Now, the process of the glycolysis and HMP shut. Glycolysis, it is the breakdown of glucose up to pyruvate or lactate, and it starts from pyruvate and oxidation. HMP shunt. It is the breakdown of glucose. Two yield different metabolic intermediate and product are two molecules of fructose 6 phosphate and one molecule of 3 phosphoglyceraldehyde. It starts from glucose 6 phosphate. There are no subtypes. No ATP is utilized or produced. It produces NADPI2. It occurs mostly in those tissues where lipids and steroid synthesis takes place. For example, adipose tissues, lactate mammary glands, adrenal cortex, thyroid, testes and ovaries, liver and RBCs. Oxidation occurs in the first step. Productions of carbon dioxide is a characteristic feature. It produces pentoses, ribose and ribuloses. Three molecules of glucose are required for the complete oxidation, and products are not dependent on TCA cycle. While in the glycolysis and product pyruvate is dependent on the TCA cycle for its complete oxidations. Thank you very much.